Now we tell you about the settings in reference to a particular mode. Let's take the example of volume control mode, which is the most commonly set one. When we go to set a mode, it will ask us the amount of volume which is needed. So we write as 500 ml. The respiratory rate which is required, let's say 10 per minute. And this will give us a breath cycle of 6 seconds. And then the ventilator asks you, how much inspiratory time do you want? We can express it as an absolute I time or in terms of the IE ratio. Let's say we set an absolute time of 2 seconds or an IE ratio of 1:2, which for a 6-second breath cycle would mean 2 seconds of inspiration and 4 seconds of expiration. Now let us look at what happens when we set the mode. That the ventilator now comes to know that at least 10 breaths have to be delivered in every minute, which would mean that every 6 seconds the ventilator has to deliver a breath. And we assume here that the patient is making no effort at breathing, he is paralyzed, and we are in a total control mode. Let's say the breath starts at this point, which is the trigger. Since we have set an inspiratory time of 2 seconds, the breath will continue for 2 seconds in the inspiratory mode, and then it will change here from inspiration to expiration. So we know that after the breath starts, it will continue for at least 2 seconds, where it will change in the expiratory mode. So the cycling here is taking place by time. After that, the expiratory phase starts, and according to a breath cycle of 6 seconds, 2 seconds have already gone into inspiration. So another 4 seconds, the expiration will continue. Now a new breath has to start. We know that this new breath is starting because a particular time has passed, and so we could call it as a time triggered breath, which means every 6 seconds a breath will start, which will start the inspiration. The inspiration will continue for 2 seconds, then the breath will cycle, and the phase will go into expiration, which will last for 6 seconds, and again a new inspiration will start. So the trigger here is time, the cycling here is time, and the target that we have set for the breath is a volume. And in trying to do so, there could be a rise in the airway pressures, but which is not what is predefined and which is not what is in our control. So in a volume control mode, what we have in our control is the tidal volume which is to be delivered. What we have in control is the inspiratory time that the breath will continue, and then there will be an expiratory phase which would have all remained the same, but the entire idea changes when we try to put them in what is known as assist control mode. And I said, for all practical purposes, all new ventilators work in the assist control mode, which means that the ventilator will deliver 10 breaths, but if the patient makes an effort to breathe more than this rate, then the ventilator will allow it. Now this wants the ventilator to recognize when the patient is making an effort to breathe. When does the cycling take place? Can it be decided by the ventilator? In some modes yes, in some modes no. And how is the breath cycle defined when the patients are on a assist control mode?